Hey, what's up, Embodied Anatomy fans? This is Mike coming at you from my apartment where I just got off a Skype session with the fabulous Liam Bowler. And we're sort of really getting into the home stretch of planning out this 3.5 day Embodied Anatomy course. And one observation both of us had is that we both have a few folks in our network who they feel like they're exactly the folks that would love to sign up for this course, but they're still not quite clear on what they're in for if they decide to come to the 3.5 days. So the purpose of this video is just to give you a sense for how we're arranging the pieces on those days. We're still definitely figuring out a few tweaks as far as how the schedule goes, but why would you want to come to this class, and what are you in for if you decide to come to this 3.5 day Embodied Anatomy immersion? So this class is really for folks who are coming from the movement therapy world or from the manual therapy, massage therapy, bodywork world, and for folks who have an instinct that embodiment, that somatic connection is a way that you want to work. And maybe you have spent some time within a particular discipline there, like you have studied some Feldenkrais or some Alexander technique. Maybe you have enfolded embodiment practices into your manual therapy. And perhaps you've seen that each of these methodologies lends some power to your work, but also has blind spots. It also has sort of silos that cut you off from other ways of understanding the body, other ways of solving problems in a client-centered way. So the intent with this 3.5 days is to develop a way of working with embodiment that is rooted in embryology and in sort of actual fascial architecture of the body, and using that as a translational medium to enfold a lot of traditional movement and embodiment practices, and also as something that really comes alive in your practice, however that works for you. So the methodologies we're going to be employing are palpation, let's say feeling a bit of architecture within yourself, exploring that, deepening that, connecting that, and guiding a perceptual shift in someone whom you're helping. So that's the intent of the class. How are we going to build that over 3.5 days? On Thursday afternoon is when the class begins, and the whole plan for Thursday is to lay out the sort of lexicon, the sort of architecture for the rest of the course. So we're really going to start with establishing some broad intent and some themes for the class. What kinds of methods are we going to be using? What intent do we have? We're going to lay down some themes around what do we mean when we say embryologic development? What is that development, and how does it not stop, but how is it a continuing process in the adult human? We're going to talk about the major forms of embryologic midline that are present in the adult human. And so it turns out that when we say it's all connected in the body, some things are more connected than other things. So for example, the dura and the covering of the central nervous system connects out to the peripheral nervous system more robustly than it connects to its container. Same thing with the visceral column, and same thing with the layers of myofascia in the body. So we're going to start from an exploration of midline and then delineate some connections out to the limbs. That's going to be Thursday. So a little bit of anatomical history, a little history of science as it relates to different traditions of anatomy, a little bit of history around embodiment practices, and just laying down the broad strokes of the architectural map that we're going to be deploying in some more detail later in the class. On Friday, so the 3 full days are going to look like this. Breakfast in the morning, 9 to 12, it's going to be more movement focused, and then 1:30 to 5:30, it's going to be more sort of perceptually focused. So it's going to be more about the architecture and learning some novel bit of anatomy and ways of embodying that anatomy. So on Friday we're going to be sort of doing more yoga-esque movement and feeling out that midline that we developed on Thursday. In the afternoon on Friday we're thinking about really starting with a sense of the pelvis and how that the layers of fascia in the pelvis extend into the legs. And what we're hoping to do is to develop movement practices that cultivate a concentric, a layered sense of the legs, of the ankles, of the pelvis on Friday afternoon. On Saturday, we're going to get into some more gritty movement in the morning, to say more joy of effort kind of stuff. So we're going to be looking at continuities of myofascia in the lumbosacral area. We're going to be looking at the way that breath moves inside the thorax. Saturday afternoon, we're going to be working more with the architecture of the autonomic nervous system. So here I'm talking not just about the functional connections of the autonomic nervous system, which might be more familiar to you, but what is the anatomical course of the sympathetic trunk of the vagus nerve? And could it be useful to build that map out, use it as a focal point for a movement practice, for a palpation, for a self-exploration? We're going to take that into a discussion of the cranial base, of the facial architecture. We're going to take that into a discussion about the voice. And so we're going to end Saturday afternoon with some vocalization and really using the resonance of the voice to feel the column of the midline from the inside out. That's the idea, at least right now, for Saturday afternoon. Sunday, the movement practice on Sunday morning right now is going to be kind of a theme of neurologic emptying out. So the idea being that we all have kind of halfway expressed motor patterns in our movement, and there's a broad swath of movement practices that are really about emptying things out, that are really about allowing quiet movements to be cultivated and expressed, and then cultivating space in a given limb movement. So you might think about Traeger-like motions. You might think about unwinding as a process here. You might think about anything where there's an imagery having to do with space, having to do with getting out of the way. This is the theme right now for Sunday morning. Movement practice around the theme of emptying and spaciousness. And then Sunday afternoon, the last part of this workshop is really all about synthesis. How does this embodiment practice come to be useful to you in your movement practice, in your bodywork practice? What are the points within the sessions you do where you could plant the seed of embodiment through the questions you ask, through the assessments you do, through the kinds of conversations you cultivate with your hands and with movement through the course of a session in the service of your patients? How does this become useful to you in everyday practice? Dare I say enjoyable to you in everyday practice? It's all about synthesis, and so we're going to touch on a few more anatomical themes on Sunday afternoon, but it's all about connection into your everyday life, with the hope that this 3.5-day class is not just a badass time with some amazing people, but that it really grows into something that gives back over time and transforms the way you are practicing with people for months and years to come. So that's the idea for Thursday afternoon through Sunday evening for the 3.5-day immersion. This idea will evolve, but we thought we would just give you a sense of what we're planning right now. I hope this was helpful, and we are so excited and hope you can make it to Embodied Anatomy August 24th through 27th. Have a great day.